our first presenter is Alisha. Alisha Redelfs is currently an associate professor at Brigham Young University. She is an implementation science dedicated to making best practices in health accessible and available to all communities. Alisha's research ranges from partnering with community organizations to develop and evaluate programming to finding novel approaches to address a variety of social determinants of health. Before coming to Brigham Young, Alisha worked for multiple years as the Deputy Director of Research and Evaluation at El Paso del Norte Institute for Healthy Living at the University of Texas. In that time, she oversaw 45 evaluations in a variety of programs related to healthy eating and active living by local nonprofits, school districts, extension agencies, and others, both in Texas as well as on the other side of the border in Mexico. In 2015, Alisha began testing the Vegemeter prototype in a community setting to serve as an objective measure of fruit and vegetable intake during all of these different program evaluations. Since then, her team has gathered over 8,000 participant data using the Vegemeter, and today she will be talking on sources of variability for the non-invasive measurement of dermal carotenoids using reflection spectroscopy. Alisha, welcome, and go ahead and take it away.
All right, can y'all hear me okay?
Sounds great.
Doing all right? Okay. So I added a little bit more to my intro because coming from public health, I may have a different approach to how I use the Vegemeter and how I the kinds of research that I have done in the previous years than maybe many of you have. So I got thrown into using the Vegemeter just after being hired to oversee all of these program evaluations. And we decided that the Vegemeter was the only accessible, community-friendly device at the time. I'm trying to get my slides to share here. Can you see those now? Okay. I think that's working. So my colleague Leah Wiggum had worked with Werner Gellerman and Igor Ermakov previously. So in 2015, we were able to jump forward. In 2015, we were able to start partnering with them to pilot a preliminary version of the Vegemeter that looked the same and had a completely different scale and did not account for skin tone, anything like that. And we started using that in these evaluations that we were doing. We have a few early papers. This one, they were mostly presentations to different societies. So this one was for the IEEE, which is an engineering conference. This is for experimental biology. There were two for experimental biology. Let me go back. This one specifically, as we started collecting data with one school district, we realized that we were measuring middle schoolers, and we were trying to test a cafeteria intervention that some partners had created. And what we found is that when we would measure students, at least a third of them had so much staining on their fingers from eating Taki chips that the measurements were completely invalid. So we went back to the office and tried to figure out, well, what do we do about this? Like, how can we don't want to throw away a third of the data. So we did a small study where we brought in some volunteers and measured them before and then after they had eaten Takis, and looked to see how the scores changed on their fingers. And it was pretty dramatic, really dramatic. Even after having washed their hands again, you just couldn't get the staining off. So some of it is the food coloring, but there's also actually chili pepper on the outside of those too. So there's actual carotenoids that are being placed on the skin. So what it's seeing is easily going to be what's on the outside before it gets to what's on the inside. So it messed up everything. So what we decided was that the only way that we could really minimize the effect of this kind of problem, where we can't control what the kids are eating, was to figure out which fingers get stained the most. And so we did a bunch of observations of these middle schoolers, and they almost always ate them with their thumb and their first two fingers of their hand. So it was almost always a thumb, index, and then middle finger that were stained, but your ring finger and your pinky were not. That's where we came up with, well, let's use the non-dominant hand, and we're going to use the ring finger because that's the only one that we can figure out that is like, it's going to be the best one. When we looked at the pinky versus the ring finger, because we were measuring all of the fingers for the first few groups of people we brought through, there was enough of a difference across the fingers that we wanted to use as large of a finger as we could while minimizing the staining. So just one quick example of the kind of way that we have used this. This specific example program evaluation is from 2018. It's a school-based wellness program, comes from a rural school district. They had a salad bar plus a whole bunch of other things that they were doing in their school district to increase fruit and vegetable intake. They didn't have a summer feeding program. So what they asked us to do was use the veggie meter at the end of school and then again at the beginning of school and see how things shifted. Some thought that we would actually see fruit and vegetable intake increase because there's more availability, like there's more fresh fruits and vegetables during the summer. And we did see that in a few people. So you can see where the blue bar chart, where those bars go up, those are the individuals who had an increase in score. But the red are the people who had a decrease in score. So this wasn't a huge sample size. It's not like earth-shattering or anything like that, but it's an example of the kinds of ways that we have used this device over many, many years. So I've been using it, like I said, since about 2015. What I want to mostly focus on for the rest of my time today is, in collecting data with so many people over so many years, the problems that I have seen. And over the last few years, I've been trying to systematically figure out how to measure those errors and finding ways to see whether my hypotheses are accurate or not, as to whether those errors are just in my head or if they actually exist systematically. So the first one that I want to talk about, this really showed up as we were starting to collect a whole bunch of data in 2022. So starting in January, I was doing a pretty large study where we were collecting up to 600 scans for each individual to try and test lots of different things. So we were testing all the fingers, we were testing different kinds of staining, we were testing multiple devices, a whole bunch of different questions. And you can see on this image, on the left side, we have the reference chart for one of the devices that I have, where in order to be able to move forward using the veggie meter, we use what's called the black stick, the black calibration stick that tells the veggie meter this is what black is. And then we put in a white stick like these that tells the veggie meter this is what white is. And you are supposed to have a value that falls somewhere within the range that comes with the user manual. So in the case of this specific device that's listed, it's between 45,000 and 54,000 for this tallest peak. You can see, though, looking at these three different white sticks, these white calibration sticks, they are not the same color at all. So the one on the left is a brand new stick that I just pulled out of the package, never been used. Sticks 25 and 138 they were both brand new. I got them from Werner in December of 2021, so right as we began this study, because I had seen some yellowing in the previous white sticks I was using, and I wanted to make sure that we had fixed that for this big study. Um, and within 2 months, this is what they both looked like. They were not able to even calibrate the devices anymore. I couldn't get using these two white sticks, I couldn't get the Veggiemeter to get within the range that it needed to be in order to be accurate. So I've had to keep repeatedly requesting more white sticks. And I've talked with Werner and I've talked with Igor about like, how can we clean these? The way that they're made, the plastic is pretty delicate on these. So they even suggested not washing them with like soaps and things like that. Um, so I had to come up with some other way of like, how do I avoid this? Because I'm afraid that if systematically over time, this oil is accumulating on these, and that is then changing how my Veggiemeter is calibrated, is that influencing scores long term? Like, does it mean that scores are going down or are they becoming less precise? Like, I don't know. I don't know what that means.